historically, for the last couple of years, Lake Regional and our presence here, we've talked a lot about facilities. We talked a lot about we're putting bricks and mortar up, which obviously from a healthcare delivery perspective is very, very important. We're going to shift gears just a little bit today with an update on what we're doing here and what commitment means to us to the greater Eldon community. And I say the greater Eldon community because just when you get to the city limits doesn't mean our commitment has stopped. I mean, to this entire part of what we consider to be an incredibly important element of our service area. Excuse me. And also one other thing, I'm trying to get over a cold I've had for about 3.5 weeks. I haven't found a good doctor yet. If anybody knows any, they'll let me know. So, our pulmonologist gave me an inhaler, and every time I see him, I keep telling him he's a terrible pulmonologist. He's starting to think that's not very funny at this point. But anyway, Eldon has a lot of exciting things going on. I mean, there's new jobs coming into this community. There's a new energy coming into this community. We're continuing to see development in a lot of different ways, and that's inspirational. And I think that really demonstrates that this community is absolutely moving in the right direction and has a very, very bright future. And we're really excited to be a part of that. And I'd like to shift and talk a little bit about the investments that we're making now in our ability to help take care of this community. Having physicians, having healthcare providers, whether they're doctors or nurse practitioners or PAs, I mean, that's the heart and the soul, and that's why people come to facilities. I mean, we can paint this lobby just as nice as it can possibly be, but if we don't have the right healthcare, caregivers in it, whether they're physicians or advanced practice providers, we're not doing the right things. And I'd like to introduce a couple of people today very formally to everyone. Some of them you may know, some of them have been here excuse me, for a little while, and some of them are fairly new. And I'd like to go through a couple names. So first of all, where's Dr. Barnes, Randy Barnes? Where'd he go? He's back there with all the Harley and Dr. Barnes has been a member of the Lake Regional community for a long, long time, and he's working with us a couple days a week up here to provide care for folks in the Eldon community, mostly on the family medicine side. So he takes care of sort of the full spectrum of everybody that lives here. Next, Dr. Mitch Bartley. Dr. Bartley, does everybody know Mitch yet? Okay, we have a line formulator. We'll talk about Mitch a little bit later. Let me know what you guys think. No, Mitch, Dr. Bartley has been a member of the Lake Regional team for 5 or 6 years now. And when we started looking at placing the right complement of physicians here to serve this really important community, Mitch was somebody that we decided, and talked with him about coming up here. Mitch is a family medicine physician, so he takes care, obviously, as everybody knows, from newborns all the way to, to older adults as well. So really that full spectrum. Next, who's not here today, I don't think it's Julie Russell. Oh, Julie, there she is. Okay, hey, I didn't see you. So Julie makes sure these guys look better than they deserve to look. So she also
comes with a cost.
Yeah, so we have to pay her a little extra to work with them, but that's a whole separate story. So really glad we have a great family medicine team here, and really excited about what's going on with them. Okay, now the shy one that's hiding back there in the back, one of really our newest additions to the medical group, Dr. Eugenia Benina. Dr. Benina just joined us. She just graduated, like 4 months ago, from her residency program in Texas Tech, and she's an internal medicine physician. So internal medicine deals with those of us that are sort of, we call ourselves older adults. It doesn't sound very sexy, but that's all we got to go on. But again, Dr. Benina just joined us, new out of residency program. Her husband is also a member of our team, but he's over in Laurie in the Sunrise Beach area. We had to separate them, so we felt that's probably the right thing to do. But Dr. Benina really adds, I think, a very, very important dimension to our care capability here. It's important to be able to have physicians that are uniquely trained in caring for older adults. I mean, things start changing, as some of us probably know. So it's important to be able to have an internal medicine physician here caring for folks that begin developing and having to contend with chronic conditions. So we have a really good sort of overlap from family medicine into internal medicine, but also a little bit more of a stronger focus on older folks as they begin dealing with some of the challenges that they may experience. On the way over on the other end of that spectrum is a guy that's been here for a couple years, or a year and a half or so, is Dr. Jason Hagley. Dr. Hagley's a pediatrician, been in, I'll say, the mid-Missouri community for a long, long time. Joined us, how long have you been here? About 3 years now? About 2 years. And he was down in Osage Beach, and then when the opportunity came to move him up here, moved him back up closer to where his practice was originally in Jeff City. And he's been an amazing addition to our medical community here. So as you can kind of see, we're positioning ourselves clinically to be able to care for everybody from day one until day whatever. And we think that that's really, really important to be comprehensive in our care capabilities here. So then last and certainly not least, so I'll call it day, like when you ever watch like the space shuttle launch and they have like T minus whatever. Okay, so our T minus guy is right there. That's Dr. Ken Holt. So he is an OB-GYN that has been with us now for going on about 6 months or so. Has been in the mid-Missouri community for a long, long time. We started talking to him, almost a year ago, I guess now, and really, really glad he's joined us here. He is here full time in the Eldon community. I mean, there's a ton of business relative to. I don't know what you guys are doing, but we are delivering a lot of babies. We'll let him discuss that later, probably with some of you guys. Anybody's interested in helping us develop that business line, talk to Ken as well. I'm going to say out of those conversations. But again, we're really glad that we've got Dr. Holt here to be able to care for the OB-GYN needs of this community. But that's a really important component of what we're doing. One of our key, very, very key service lines at Lake Regional is women's health. And women's health is not just the delivery of babies. It's not just annual visits. It's all of the other things that are very unique to women as they go through the aging process as well. And that connection between, I'll say, the traditionally understood women's health and then cardiology, oncology, the things like that sometimes occur in the lives of our patients that are women. So we're really, really happy to be able to have Dr. Holt here on a full-time basis, and again, I think he's been very, very well received, and it just underscores again, I think, our commitment to the people that live in this community and the healthcare needs that clearly you guys have. Also on this campus, I mean, you guys can see the sign over there. We are rotating subspecialists through here. Matt and I were talking about Dr. Eric McQuarrie, who's our urologist, really young, amazing young physician. He's been with us for a little bit over a year, and I think he right now is probably one of our busiest surgical physicians on staff. So he certainly helped fill an incredibly important need, and he rotates through here. Dr. Kahn for cardiology. So again, we're really trying to make sure that we have coverage. I know it's not that far from here to Osage Beach to where the hospital is located, and a little bit more densely clustered, specialty ability. But again, we want to try to bring care to the community as well, because we realize, in some of the instances with our patients, it's difficult to get to the hospital, even though it's not a great distance. I mean, we realize there's challenges there. So the more we can do as we continue to grow our abilities here, we will continue, doing that for this community, because it's important. I mean, we have tons and tons and tons of employees that live in the greater Eldon area. So, I mean, this community is our community. It really is us. So we take that very, very seriously. I forgot my glasses, so as you can imagine, I can't see a darn thing right now because I'm going through the aging process as well. But I'm not going to go see Dr. Holt. So we'll just leave that at that. Obviously, things you guys know we have here at the clinic: full service pharmacy, drive-through. Please don't hit the building if you're driving through the pharmacy. Physical, occupational, speech therapy services, that has happened. Not here. We'll just leave that at that as well. Cardiopulmonary rehab, so being able to do cardiac rehab for patients that have had cardiac events. I mean, that's a very important step in recovery. And then also digital x-ray, which is part of the clinic, and then also the urgent care capabilities that we have here. Hospital update. We've got a lot of things going on at the hospital. Lake Regional is absolutely in an incredible growth mode right now. We are investing extremely extensively in clinical capabilities. We, as you guys may or may not know, we are the only hospital between, if you draw a line in Missouri, and this is really important, if you put a finger on Columbia, a finger on St. Louis, and a finger on Springfield, and you draw that big triangle which covers the majority of the middle part of this state, We are the only hospital in that region that is certified by the state to be trauma designated, stroke designated, and STEMI designated. STEMI is a very, very deadly type of heart attack. I mean, the Widowmaker that's sort of famously known anecdotally is a type of STEMI heart attack. So again, very, very lethal types of heart attacks. So we're designated by the state to be able to care for patients with that. We've got, I don't know if you guys have seen it flying around, about a 3-month-old helicopter right now, brand new helicopter that we co-work with the University of Missouri and MedTrans, and then us to be able to have that level of aeromedical transport. They have about 200 different landing zones predefined in the greater community. There's a ton of them around here in Eldon. So, God forbid you're at home, you have a massive heart attack, you're actively dying, EMS can't get you there. We can be up here in probably 4 minutes flight time. They'll land within a block or two probably of your house and have you back at the hospital. Our STEMI time to getting a catheter deployed and actually having blood flowing again in an occluded vessel. The national standard from the American Heart Association is that we should be able to do that in 90 minutes. We, on average, do that in less than 40 minutes. So we're less than half the time that the AHA says is quality care. And I can tell you there was a time when we actually had a patient come in the door, they cut through the groin, had the wire in, and had the stent deployed in 12 minutes. So that person who was going to die, who was actively dying, or was going to have horrendous complications from, loss of cardiac function from that, probably got up the next day and walked out of the hospital and went back to work. So, I mean, that's the capability that this medical community has here for the folks that live in this region. That's really, really important. So, again, we're proud of what we do. You're going to hear me every time I get a chance to talk to anybody. You're going to be tired of hearing me say how uniquely capable we are. And as my folks are absolutely sick of hearing this, but hopefully they've got some tattoos now that say this on it too. We aren't supposed to be able to do the things that we do. 116 bed hospitals typically do not have this level of capability, and that makes us a very, very unique and very special and very rare type of health system. And our commitment to being a very high quality and very safe institution is something that we take amazingly seriously and work on every day. So I think that's probably it for the big announcements. One other thing, as Matt and I were talking before we got started here, we have an incredible campaign that is kicking off at the health system as part of our continued commitment to developing and growing services. We just announced, hopefully you guys saw it in the paper a couple weeks ago, about a $25 million addition to the hospital that we're beginning to do some fund development and money raising for. What we want to do is take and consolidate and aggregate a lot of our cardiac services together, make those much more convenient. We're growing very quickly in cardiology right now, and also oncology. We have 2 full-time medical oncologists and a nurse practitioner that work with those physicians. And I actually had a chance to tour down there yesterday. We had a candidate for one of our executive positions. Somebody's retiring, so we were touring a candidate around. And when I was walking through oncology with her, and we went into the infusion department, and that's not a place you really go to real often. And it was a very, very stark reminder to me as I walked into, and we're not a big hospital. We're not a big national NIH certified cancer center where you have thousands and thousands and thousands of patients there. But in our small community, in the Lake of the Ozark region, and I walked into that infusion center, and every single chair was full. There was a person in every single bay, and every single one of those people was suffering from a different type of cancer. And if you guys have looked at any of the data, about 2 out of 5 people nationally in our country are going to get cancer of some form or another. It is a massively present thing. And while we, technologically are learning a lot about how to treat it, I mean, there's a huge, huge need. We have an incredible amount of lung cancer in this community. We have an incredible amount of breast, prostate, colon, on and on and on. I mean, we see a lot of the typical cancers, but we see an incredible amount of lung cancer in this community. And we have to commit to being able to have added care for that. So part of this project is being able, unfortunately, to expand our cancer care capabilities, because that's something this community is really struggling with. So we're trying to raise about $15 to $20 million out of the $25 million to be able to do this. And it's a really important thing for this community to be able to have that type of care, very closely. We work extremely closely with some of the regional physician groups. Same radiation oncology group that covers most of the hospitals in mid-Missouri, from the university to Boone to us. I mean, it's the same radiation oncologists. And again, we've got really, really high capabilities in that space, unfortunately, but it's something that we have to do because it's something that this community needs for us to be able to do. So we're very, very deeply committed to continue to grow and develop services. So we'll have a little offering bucket going around, 25 million, that's the number. So divide it up however you want to, and we'll go from there. But really, we can do it on our own, but it's going to take us a while to be able to do that. With support from the community, financially, we can do it sooner, and we can get that care delivery enhancement here so that folks don't have to drive an hour and a half, 2 hours, 3 hours for, quite frankly, equivalent care. Patients get sent out from our hospital all the time for second opinions, and they come back and say, the oncologist in Kansas City said what you guys said. And it happens all the time. So we have incredible capabilities, and we need to be able to expand that. So.